Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dol Simons Family Studio on this cloudy, it's still beautiful, but cloudy spring morning. You know, it's been so great. The trees are starting to blossom. The birds are starting to sing, and you're like, I can feel spring in the air. And isn't that a great feeling? And today we have a great feeling on our program because we have the CMOs from several other health systems with us. They've been with us before. You'll know them. Mark Steele over at Truman Medical Center, Larry Botts from Advent Shawnee Mission, and Raghu Adiga from Liberty Hospital. You know, we've had a great conversation with them before. It's going to be such a fascinating one today because we've talked with them through things when we were starting out, when things got really hot. Things are a little better now, but maybe they're not as good as they were just a couple of days, Hawkeye. What's up?
Yeah, the acute infections have gone up.
How many?
16.
Ooh, man, that's a double. We were down to 8. We're at
I
16 and going up. And you know what? That's happening throughout the country. So tell us the numbers.
3 ICU, but 2 of those are on the ventilator, so a large proportion, obviously, even though it's a total small number. 18 in the recovery period. Hays is doing well. They have 1 active. They are continuing to do well, good for their hospital capacity. Our numbers are still good for our hospital capacity, but it's certainly not where we'd like it and isn't where it has been.
Yeah, you know, and what you get nervous about is that trend is starting to take off through the country. We saw people starting to gather more. Spring break was going on, and granted, it's only a trend, but it's not the right trend. I know we're going to go to reporter questions, but let's first just jump to our CMOs who are on. Let's just see how things are going at their hospital. Mark, how are things at Truman?
Hey, good morning, Steve, and thanks for having me on again.
And thanks for being back with us.
We've actually seen a little tick up here in the last couple of days as well. We currently have 13 active patients in the hospital, 3 are in the ICU, and fortunately none are on ventilators. 2 days ago, we were actually at our recent low of 8 patients, and these are some of the lowest numbers that we've had since last June. In terms of vaccinations, which is obviously the big deal currently and is good news for everyone, it's hard to believe that we've been at this now for more than 3 months, starting way back on December 14th. To date, we've actually given over now 67,000 vaccinations, and we've had a number of days where we've given over 2,000 in a single day. We've also been out in the community 2 to 3 times a week, holding clinics, including at Morningstar Baptist, St. James Methodist, the Linwood YMCA, the Tony Aguirre Center, Friendship Baptist, and Della Lamb. We also have a partnership with KCATA, and we've worked with the public housing for an option to get their resident seniors vaccinated. Last Monday in Missouri, as you may know, moved to phase 1B Tier 3, allowing us now to begin vaccinating teachers. So in partnership with Children's University, we began vaccinating teachers in their own schools and districts and have now vaccinated over 4,000 teachers, including many in the Kansas City Public School District, Graytown, Hickman Mills, Fort Osage, Independence, and Blue Springs districts. The North Kansas City and Lee Summit School teachers are up next, followed by Green Valley, Platte County, and the Center School teachers. So we're excited to be part of that initiative. And then this past weekend, we participated in the Mass Vax event at Arrowhead in partnership with the Jackson County Health Department, Missouri National Guard, and we had volunteers from Children's Mercy, AmeriCorps, and medical students from the UMKC School of Medicine, and administered over 7,300 doses of the J&J vaccine during the 2-day event. And so the weather was beautiful, and it was really a very impressive and exciting event for us to get to participate in. So that's kind of what is up over here at Truman currently.
And just to say, Mark, you all have just done, you and your team, you guys have just been a force in the community, reaching into all communities, and I don't think you'll probably get enough thanks. So I just want to say thank you to you guys, to all you and your team, and to everyone you've been working with for doing the great things you've been doing around vaccination. You guys have just done great work, so thank you for that. Dr. Adiga, how are things up at Liberty?
Hey, good morning. Thanks for having me on. At Liberty, things are going well. Just like everywhere else, I think we've started to see a little bit of an uptick. For the past, 3 to 4 weeks, we've been in single digit. Today, we have 7 patients with COVID in the hospital, 2 in ICU on the ventilator. We had gone down as low as 3 a week or so ago, and had started to come back up. Same thing with Clay County. The overall numbers in Clay County had been somewhere around 40 to 60 per 100,000 population per week, and it is starting to tick up a little bit, so we're going to have to watch that. Overall, I think our employees' vaccination has been a success story. It's been 2 weeks now, 2 consecutive weeks. We have no employees off work or being tested for the virus. That's been really a good thing. In terms of vaccinations, as you know, initially we did our own vaccinations of staff and some of the community healthcare people and first responders and a few high-risk patients on our own. And last week we were able to partner with several other community partners here, North Kansas City Hospital, Cerner, and Clay County Public Health Center, as well as the city, several cities around us, and started a high throughput vaccination center at Cerner called Operation Safe. And that's been really an uplifting success story in the Northland. That's been actually a model in this area. We've been able to vaccinate as high as we went several days with 3,900 vaccinations a day. We are about touching 4,000 when we have the vaccines. And so far, I think we've given out well over 50,000 doses there. And we're also partnering with Missouri National Guard. In fact, today we have a Missouri National Guard run clinic where they use some of our vaccinators at that site. So that's been really a good thing. Several days of the week we have a clinic going there. Beyond that, I think on the long run, we will probably look at what we can do in our high volume clinics and potentially with some employers around once the vaccine supply really goes up. But that's the key. I think we need to get the vaccinations going, and with the spring break and religious gathering coming along, it's just the last leg of our efforts. We need to keep our the distancing and masking going for just a little while longer until we can get these vaccinations up, especially since we are turning into the younger generation who are more mobile and likely to be spreading. We've been doing only high-risk people up until now. It's as important to get to this population. So that's what we're looking at in the Northland.
And Raghu, thank you for your great work there and at Liberty. And you've worked a lot. I also a shout out with all your work with the nursing homes up in the Northland. I know that's been a big focus for you. And to that Cerner mass vaccination clinic is a pretty great success story, as you mentioned. So thanks for all your great work and to your friends there, and also up in North Kansas City. Jim's not on with us today, but you guys said there's a great team up there and a lot of teamwork going on between Liberty and North Kansas City. Laurie Boss, you there?
I am there.
Awesome.
Thank you, Steve. I will let you know what's happening at Advent Health Shawnee Mission. I appreciate the opportunity.
Thanks for being with us.
You bet. We have not had any uptick in our COVID cases in-house, at least within the last 2 weeks. We've been hovering between 5 and 10, which is sort of the lowest we've been for a long time. We're hoping that will continue, and just watching it very closely. Our staff is excited that we've been able to cut those infections have cut down to that level. Our vaccinations are going well. We've probably administered a little over 30,000 doses now. I, like Mark, find it unbelievable that we've been doing this since mid-December, but it's been a very successful run. We are continuing with our partnership with Johnson County Health Department as they supply us with vaccines to be able to do our vaccinations at the Church of the Resurrection in South Overland Park. We're doing that on a weekly basis. We do about 2,400 first dose Pfizer and 2,400 second dose Pfizer a week in 2 clinics out there. And that partnership with Church of the Resurrection has been a really good partnership for us. And I think those events have been very successful. And we're happy to be able to contribute to the population in Johnson County and get them vaccinated. We've also partnered with Mercy and Truth, a safety net clinic. We've done a couple of small clinics at some churches, El Centro, trying to reach that population that is at high risk and doesn't have maybe the access that some of the other populations have. We're hoping to be able to continue, as long as the vaccine supply is available, continue to do our clinics at the Church of the Resurrection all the way through May. So that is scheduled through there. Following that, or with greater degree of particularly Johnson & Johnson vaccine, we may be able to expand and do some within our clinics as well. So vaccination is going very well. We're very pleased with how it's going and happy to be able to participate to the level that we have been able to.
Yeah, and thanks for that great work. And there's something that feels right. I mean, I'm a member of Community Christian Church about getting a vaccine in a church right at Easter. I know, I grant I'm a Christian, but something about that just feels good. And special shout out to Advent Shawnee Mission for doing that great work, Larry, you and the team there, and the folks over at Church of the Resurrection. We've been able to do our vaccine clinics. We have a couple. We've been doing one here in our own medical office building and also our Indian Creek campus. I think we're going to open up another vaccine center very soon, though, so we'll end up with 3 vaccine sites. And the Indian Creek one we run on the weekends, the weekdays we're here, and then we're going to open up another site as we think we're going to be getting more vaccine and more partnerships. And we also hope to partner more with Wyandotte County and with Vibrant than FQHC here. So I think the vaccine.
Too, that those are all by appointment only.
They are by appointment only. That's right. For now, we'll see how that goes as we get as we move into the next phase of vaccination, which we think, so far there's been, everybody needs to get a vaccine. And then with all this prioritization and all that discussion, I think we are going to be taking a deep breath, and in the next few weeks moving into, we got a whole lot of vaccine, let's go. And then we're just going to come looking for your arms, or hopefully you'll bring your arms to us, or to all of us that you hear from today and throughout our metropolitan area, so that you keep yourself and your family safe. And you heard Raghu tell the same story. I mean, we were averaging 25 new COVID patients a day amongst our own staff. And I should say not patients, but positive tests. And our rolling average for the number of people who are out from work could sometimes get up to 100 with COVID, and even more than that. And now we just don't have anybody out from COVID, and we get maybe 0 or 1 person being tested, turning positive. And remember, the shot protects you from getting very ill, but really what it does is, that's what it really does, but it also can help prevent others from giving you the disease. We think it cuts back on transmission a lot, and we see that within our staff. We've just seen a huge drop in the number of COVID positive tests after people get vaccinated. It is the real deal, and it is going to save lives. So, hey, Jill, let's see if there are reporter questions out there first.
Well, I have a couple here.
All right, let's roll.
Yeah. Donna Pittman with KMBC News wants to know, and this will actually be a good question for tomorrow, too, because we're going to have the long haulers. We're going to be talking about that. But she wants to know, are you encouraged by the new study that shows long haulers might benefit from getting the COVID-19 vaccine? Should long haulers be encouraged? Should they run out and get the vaccine?
Everybody needs to get the vaccine, but Hawkeye, I'm encouraged. We'll talk to Raghu as well and see what he thinks. You guys are both infectious disease docs. Tell me, what's the science behind vaccine helping long haul?
I don't know. I don't know of the study. I know of the anecdotal reports. I know it's being investigated right now that people said, I do have these chronic symptoms after getting COVID-19, and then there have been, again, the reports about people feeling better and some of those symptoms resolving or being diminished after the vaccine. Again, I don't know what the mechanism would be. We're certainly trying to wait for that, and I know it's being investigated, but I'm not aware of a full study that will describe that, and I don't know if Dr. Adiga has heard of that specific.
Raghu, you're an infectious disease doc as well. Thoughts about that?
No, there is no real study that's been out yet, but that's been anecdotally reported. Physiologically, I'm having a hard time explaining how that happens, but this is a positive story rather than the negative story that you always hear, so I'll take it.
Yeah, indeed. And just to say, there's some interesting stuff that came out in the New England Journal of Medicine yesterday in correspondence. And just a shout out to our colleagues over at Children's Mercy, because they had a letter published in the New England Journal of Medicine about the effect of vaccination on their staff. And what it demonstrated, I think, and I'm going to probably say it wrong so the folks at Children's don't get wrong, but I did read it this morning, and I did want to make sure we recognize the great work for getting that in. But it does demonstrate within a hospital staff and at Children's how even those who are both vaccinated, that getting vaccinated helped those that had COVID as well as who didn't have COVID. And they did some serology testing to help monitor it. Good information out there. Everybody needs to get their vaccination. Just because you have COVID doesn't mean you're fully protected. Get your vaccine. And it is a good news. Now, as far as the long haul syndrome, I'm delighted to see it. I don't know why it is, but I'm sure there'll be more information.
Well, and I think that is so important if there does prove to be a mechanism and that it truly does help. Just because we know that people have decreased quality of life, several months after getting COVID-19, up to 30% in some studies.
In fact, I think our long haul clinic is seeing 4 to 6 new patients per day. Now, we have about 9 or 10%, let's say, of the patient population of Kansas City or whatever. Let's just say there's 10 times. That means there's like 50 to 60, and I bet even more than that, people suffer from this, that are coming in every day with long haul syndrome. That's a problem, and we're going to have a lot of work to do as we go forward. You know how you prevent long haul syndrome? Don't get COVID. You know how you not get COVID? You follow the rules of infection control. You know what else you got to do? You got to get vaccinated. No questions.
Yeah, also for Channel 9, this time with Brian Johnson. He has a question for the panel regarding faith communities that he is hearing are loosening their COVID-19 safety precautions just as we enter our spring season of religious services. And he wants to know, he's got several questions. First one is, what is your advice on singing safely during worship? Okay, with a mask, without?
Well, this is a big question. So here's what I would say. The rules of infection control travel with you wherever you go. Whether you're at church, you're at the Royals game, or you're just in your daily life. And going to church doesn't change the rules. Going to work out in a gym doesn't change the rules. The rules are the same. So let me first turn to Larry. Larry, what would you say to the church community, the religious community, who wants to get back together, close proximity, and start singing? They don't want me to sing, by the way. Everybody knows that.
I agree with you, though, Steve. I think that at this point in time, we still have to be able to follow those rules of infection prevention no matter where we are. And I think that we're looking forward to a time when we'll be able to do that more freely, that we will be able to interact without having that social distancing, masking. But I don't think that we're there yet. I don't think that we have enough people vaccinated. I think we're working very hard to be able to get there. And as you said, it looks like maybe we're going to have an influx of vaccine here soon, and that may be coming. I think just a little more patience is what I would advise. I think we still need to follow those rules so that we don't get the increase in cases that perhaps has happened in other parts of the world.
Right, I think that's right. Mark, you're traveling and your team goes to a number of different churches. Are you going to conversations with them as well about what should their rules be around Easter? And if not, what would you say?
Well, I mean, I would echo what's already been said. And obviously we would never want to see repeated some of those early stories of significant outbreaks that were associated with church gatherings and choirs singing and it spreading rapidly through the choir. So clearly, I think it's too early to be doing that, and we know that singing can spread the droplets even further. And so I think that it's too early to start that up again.
Yeah, I would say too. Hawk, anything you want to add?
Yeah, I was recently asked this question about my church too. They come to me, and it's hard because we want to do that, and it brings joy for a lot of people to be able to do that. You can do it. You can come and sing at my church. That'd be fine.
You really don't want me to sing.
But what is the safety factor there? For sure, everybody will have masks, hopefully. That's going to be the first part. I think churches and congregations are still spread out, hopefully, so that will help. But certainly when you are raising your voice and exhaling a little bit harder, you have that ability to put more viral particles or droplets into the environment, and that could be dangerous.
So the follow-up question that he has is, he also is asking about, should the faith communities be worrying about variants, and is there any risk for youth 16 and under in the congregations?
Dr. Adiga, what do you think? Is there a risk for the youth, and is there a risk around the variant?
Yeah, I mean, those are kind of two separate questions. Risk for youth, I mean, of course there is, but probably not as high as older generation or people with medical problems, but still there is a risk. In terms of variants, there is a lot more traveling that's going on now as compared to how it was just a month or two ago. So even if it doesn't exist now in Kansas City, we are going to see if, people are going on spring breaks and visiting people on the coast and everywhere else. So we have not ramped up the testing for variants as much as we'd like to. So I think we'll know in a month or so that, oh, yeah, a month ago we already had these variants spreading here without us knowing. So certainly I think that is the biggest risk, why we want to get people vaccinated as fast as we can.
Yeah, I think we do. And just if any church leaders are out there, just remember, COVID's still out there. There's still widespread community transmission. Yes, the hospitalizations were down in part because everybody got, driven inside by the polar vortex, and also by masking was really good. And there have been people being vaccinated, and the 65 and older crowd was getting vaccinated. The nursing homes were vaccinated. Those are all good things. What we are now seeing, though, across the United States, in multiple states, and we're starting to feel it here. Our numbers doubled in the last couple of days. You're seeing a rise in COVID again. It looks like there may be another surge, and it's caused by the same things that it is always caused by. When folks don't follow the rules, the virus spreads. Again, we've said this before. This virus, it does not discriminate. The only thing it wants to do is find a host. You give it the opportunity to find a host, it's going to come find you. And so the way you stay safe is you wear your mask, you try to keep your distance, and yes, that's been hard, and it's been a year that we've been doing this, more than a year we've been preaching this. But now as we go into the Easter season, how bad would it be as we celebrate Easter and resurrection to have a lot of people getting sick from COVID because we got back together again? There's a certain juxtaposition there that just doesn't feel very good. So stay safe, get vaccinated, and we'll get back to normal, or at least our new normal, and it'll look a whole lot like our old normal than it does today. But as we do that, let's keep each other safe as opposed to trying to endanger each other a little too soon.
Well, I'm out of media questions. You want to go to community?
I think that's the thing to do.
All right. So Jennifer and Sally and others are concerned about Kansas Senate Bill 40. Apparently, it would likely force counties to revoke mask mandates, and they're concerned about school districts in particular. They want to know if this goes into effect, would you still recommend wearing a mask?
Well, absolutely, I would still wear a mask. Larry, well, first of all, I'm going to take a public stance on this. We're going to stay in our lane.
Right.
We're not going to make the comments about, political actions. What we can say about is this. I've just said it. The virus is still out there. There is still widespread community transmission. Masks absolutely work because before we had everybody vaccinated, we weren't seeing any transmission inside the hospital to our staff from patients. The overwhelming proof, and all the mask doubters out there, I'm sorry, you're just wrong.
Yeah.
The overwhelming proof, and we live it every day in our hospitals, is that masks prevent disease transmission. And anybody tells you that anything else just doesn't want to believe reality. I'm sorry, they just don't. And it's very frustrating, actually, because we prove it every single day. All of us prove it in our hospitals. I don't know why anybody would want to put out to stop mask mandates right now when only 8% or 13% of our population has had 2 vaccinations. I think from a medical standpoint, I could not support that. But again, I'm not a politician. I'm not in that mix. But from a medical standpoint, it feels like masks are helping keep people alive. I wouldn't want to change
Yeah,
that.
and I think the thing to remember, too, is we all want to keep our kids in school. Schools are good places. They're safe places. They provide meals for those children. It helps to keep people, the children, going to schools 5 days a week. That helps the parents stay sane. But there is new guidance from the CDC on schools reopening. What is the foundation of all that guidance?
Science.
Masking.
Science, masking.
Masking.
Yeah.
But, they say, well, we can use 3 feet, just as World Health Organization said from the beginning, 3 feet, again, for different reasons. But the new distancing is because of the mask, the foundation of the masking. So continuing to do that is going to be the smartest thing. And it is going to be the best thing to be able to keep kids in school 5 days a week, full-time in person.
Right, and 3 feet apart with a mask, you can go to school. Okay, let's go.
Yeah.
And I think that's great, but it doesn't say 3 feet apart and no mask.
Right.
It says 3 feet apart with a mask. Dr. Botts, any other thoughts?
No, I absolutely agree with you. I think that this is a time where we can't let up, and just in the churches and in any place else. I think you're absolutely right. We have proven that this is a good method to prevent the spread of the disease, prevent people from getting sick, prevent people from getting hospitalized. And so why would you ever want to change that until we get to a point where we're all protected and we have a much higher percentage of patients that have people who have received the vaccine. So absolutely agree.
Let the record show that a couple of goofy pulmonologists in Kansas have just agreed that we are a political force to be reckoned with, Larry Botts. Watch out.
You and I. Here we go.
It's trouble for the rest of the world. All right.
Rita and some others are asking, can you tell us about the patients that you're seeing right now? Where did they get infected? Have they had vaccines? What are their ages?
Yeah, you bet. And we could talk more about that probably on Friday, especially. Actually, I'll be out for about a week, and Dr. Wild will be here. He loves some of that data. But we know that we're not seeing vaccinated people coming in and being hospitalized.
That's it. Amanda Cackler, our Director of Safety and Infection Prevention, just sent an email out addressing that specific issue because that question had come. Again, we are working to implement that into our medical record, getting that information. Right now there isn't, but there was a deep dive into those patients. And there wasn't vaccination of those patients that are hospitalized from that information. I think we can get some more information.
Dr. Adiga, Dr. Botts, Dr. Steele, thoughts about that? How are you guys doing? Who's being hospitalized now when they do come in? And are you seeing anybody who's had both vaccinations being admitted?
I'll go first. Here at Liberty, for the past few weeks, all our hospitalizations have been from the community. We have not seen anybody from the nursing homes that we used to get a lot. That's because of vaccination. So none of our patients who are hospitalized were vaccinated. And mostly they are in the age range of vast majority of them between 50 to 60 from the community. And again, community exposure, it's still going on.
Yeah, I think that your point about the nursing homes is dead on. That's the population you would think that may not have the best response to vaccinations because as we get older, we don't maybe perhaps respond quite as well. But yet, we're just not seeing nursing home admissions with COVID anymore. Another proof that vaccination works. Mark Steele, thoughts from your standpoint? Who's being admitted now at Truman?
Yeah, the same as Raghu said. Basically, most of the patients are 40 years of age and up, and mostly older than that. And we've had no one who's been vaccinated who has come in infected, and we're not seeing nursing home transfers either.
And let's say, let me turn to Larry on that.
Yeah, I would agree. Exactly the same pattern here. The very low numbers of infections and community and non-vaccinated. We haven't had any vaccinated patients, and really no nursing home. That's a very good point. We have not seen any cases coming from nursing homes now that they've all been vaccinated.
And we've had two I'm looking at from the email from Amanda, just a couple of folks who have had one vaccine, and we're within 2 weeks of that vaccine, I think, and then they may get COVID and come in. So Hawk, the story we're seeing is the same one. And I remember when Lee Norman has been on the program, he's made the same point that nursing home residents are so much safer post-vaccination. And there's a message in that to all of us, right? It's not just about nursing home patients. It's really about everyone.
Yeah.
All right, Julie wants to know if you live in the Kansas City area, can you get the vaccine in Kansas or Missouri? Do you have to live where you get the shot? Do you have to live in the county where you get the shot?
Oh man, that story's so different on Kansas and Missouri. Let's talk about Missouri first. Mark, you're an expert in this.
Well, we, generally speaking, the folks that we're vaccinating are supposed to be Missouri residents, and there are a few exceptions to that. I mean, obviously, early on, as we were doing our employees, we have a number of employees who live on the Kansas side, and so if we have sort of hold a specific event for a certain population, so like when we're doing the teacher vaccinations, if they happen to live on the Kansas side but are teaching on the Missouri side, we can vaccinate them, but we're supposed to target Missouri residents primarily, and they don't have to live in Kansas City. I mean, they could be outside of the Kansas City area or outside Jackson County, as long as they are, they fall into one of the eligible tiers that we're currently vaccinating.
And Dr. Adiga, up north?
Yeah, the same here. Our Operation Safe is open to all Missourians, but as a high throughput vaccination center, we are mandated by the state to vaccinate only Missourians. So anybody who lives in Kansas but works in Missouri still can't get it there, but any other specific event, as Mark talked about, work-related, in the future, we might be able to do that, but not at the Operation Safe.
And Larry, I think both Advent and Olathe, for that matter, as well as KU, we're getting our vaccines from Johnson County right now. Yeah. They really want us to be giving it to Johnson County residents.
Yes, I agree with that. I mean, and we're trying to do that as close as possible. I mean, we have people who live in Kansas and outside of Johnson County that still will, when they're an eligible group, who will come and get their vaccine from us. But for the most part, we are trying to target the Johnson County population because that's where the vaccines are coming from. So yes, you're absolutely correct.
I know Wyandotte County's done a good job opening up their mass vaccination sites, so they've done a really good work. Just to say to everyone out there, though, remember that the pharmacies get their doses differently. The vaccines that are delivered to pharmacies come from the federal government, and it's not part of the state allocation. And as a result, they follow different rules. And honestly, I know people going across state lines and going to pharmacies and checking at the end of the day, they're able to go to a pharmacy and get a vaccination. So there is another route to do that. And we're also beginning to see shipments now direct to federally qualified health centers, and that's coming from the federal government. And because those community clinics are going to be vaccinating people as well, they'll have a different set of guidelines. And I think in those situations, people can go just about anywhere and get a vaccine if they have it.
I don't have a problem with that at all. I mean, I think there's good points there. And we've heard Secretary Norman say last couple of weeks, if you live or work in Kansas, you can get a vaccine in Kansas. And that's probably the method that you're going to do is through those federally allocated private pharmacies.
Exactly. And I think, again, these rules are all going to be changing in the next couple of weeks. Because as more vaccine becomes available, I think it's going to become to be open season. And that, let's be honest, that's where we want to be, right? We want to be where everybody's willing to give you a vaccine wherever you go, wherever you're from. Let's just go, because that's how we get to herd immunity. That's how we get things protected. That's how we get back to church. That's how we get back to restaurants and bars. That's how we get back to, yes, you knew I was going to bring it up, Kauffman Stadium.
Hopefully at some point we can get into, go into a pharmacy, one arm get the COVID vaccine and the next arm get the influenza vaccine.
Dude, can I have them in the same arm at the same time? I want these vaccines combined.
Oh, well, hopefully.
I don't know if we'll get there or not right away.
Right.
But yeah, maybe next fall. We'll see what it brings. All right.
Terry wants to know, is there a difference in the dosage between the first shot and the second shot in regards to the Pfizer and Moderna vaccines?
Well, they come as different doses, Raghu, but I think the actual vaccine, once you the first dose, the second dose, same thing, right?
Yes, the volume is slightly different between Pfizer and Moderna, 0.3 versus 0.5, but it's the same for the dose 1 and dose 2.
Okay, so Kathy was in the J&J trial. She became eligible for the vaccine Missouri. They unblinded her record, and she told them, I got the placebo. So she got both doses of the Pfizer vaccine. Yesterday, she learned that she had not gotten the placebo. She had gotten the J&J vaccine. That means I've had the J&J in the fall and the Pfizer in January and February. She's wondering, is that okay?
think that's okay.
Yeah.
Don't you think, Hawk?
Yeah, if she's still up typing the question, I think that's okay.
She's very well vaccinated.
Yeah, I would agree.
And she said she had minimal side effects with all three.
Yeah. Interesting story.
Yeah. Raghu, any other thoughts that you might have around that?
No. I mean, I think there have been people who inadvertently gotten extra doses, and they've all done well so far. Very few people like her.
Yeah. Hopefully you won't get COVID.
Okay, a couple more questions maybe?
Please, let's do it.
All right. Amy says, can someone travel and stay overnight in my home if we mask and we stay 3 feet apart?
Oh, man, we get this question a lot. What do you think, Raghu?
What was the question again?
Can somebody travel and stay in your home if they're a traveler and they're going to stay overnight, and when your friends or whatever, they come in and they stay 3 feet apart and they're masked? Can somebody stay in your home safely?
Yeah, I mean, if it is a short duration and they have the mask on, probably it's okay. I would still try to, stay 6 feet rather than 3, because that's one study from kids in school. But beyond that, try to stay away when the masks come off, because they're not going to wear it all the time. They have to eat, and those are the kind of things I would focus on.
Yeah, I agree. Larry, thoughts that you might have around that?
No, I would agree. I mean, it's a risk. It's a fairly low risk if you're masked and you're actually trying to social distance. You have to just kind of accept that risk, but use those important infection prevention measures as well.
So, Dr. Botts, does this mean if I crash your house, you're going to feed me?
Now, you are not allowed to stay in my house, Steve. I'm sorry.
See, I knew he was a smart guy, right? I knew he was a smart guy.
Okay, we're going to give the last question to Gretchen, who says her daughter's school just announced that they're going to be having prom. And she said, I'm assuming mask. They said they would do contact tracing. She goes, seems like a bad idea to me. What do you think?
Well, Mark, I hope the prom outfits include a mask. What do you think?
Yeah, absolutely. I mean, even with mask, I think it's a little bit tricky. Just if you're getting a large group together, particularly if it's going to be indoors, and just trying to keep everyone compliant with wearing the mask. But yeah, if you're going to do it, definitely masked.
Okay, it just feels like everybody wants to have normal be here right now. And I think we got cocky because our numbers dropped.
Yeah, we all want to go back to normalcy. Again, for the CDC guidance for vaccinated people, you can meet with a small group, although that's not defined. But there is clear guidance still going against medium to large size groups. And I would say probably a prom is going to be a large size group. I think it is dangerous. There's a lot of risk involved.
And the risk may not be to the kids, it may be to their
chaperones
parents and to their grandparents
absolutely.
and everybody else around that. And man, there's this burning desire. You can feel it. I just want to be normal, and that's what was going on down at Miami Beach. People just wanted to be normal.
Yeah.
But what's happened is want has exceeded reality, and what you have to be careful is want and reality may not be the same thing, as this graph shows us about what's been happening a little bit around that. And this is last spring and what happened after spring break with the rise in cases, both number of COVID-positive patients, hospitalizations, ICU stays. And so, man, spring break can be a problem. It was last year. It could easily be a problem this year. Hey, guys, tomorrow we're back with all of our great questions around the long haul clinic. Dr. Keith Sale, our VP of Ambulatory Practice, will join us, and he's bringing along a family medicine physician, Dr. Jennifer Woodward, who is seeing success with COVID-19 patients managing their illness by helping monitor their oxygen levels at home before they have to come back to the hospital. She'll explain how that works, what it means for folks. We're going to be talking more about the long haul, and that'll be an important topic because we know that is a rising health concern. And how do you prevent long haul? You don't let want get in front of science. Final thoughts today. Let's start with you, Dr. Adiga.
The open season for vaccine in Missouri, as you talked about, starts on April 9th. Any adult can get the vaccine. So I think the vaccine supply is going to increase in April and May, and those 2 months are important. Everyone get vaccinated, especially the younger folks who are more mobile and walking around and spreading it. So more vaccines, the better. So a couple more months, keep the infection control measures just for a little while longer.
You bet. Dr. Larry Botts, final thoughts.
I just second what Dr. Adiga says. I think we need to all get out and get vaccinated. It's a very effective method of preventing this disease, and it'll get us back to normal quicker than anything else. And the supply is hopefully going to improve. So go out and get vaccinated. That's my final word.
Totally. Dr. Mark Steele.
Yeah, exact same message. There's going to be, at least by all reports, a boatload of vaccine that's going to be becoming available, at least in Missouri, more than probably a tripling of what we've been getting. And as Dr. Adiga said, it's going to be, anyone starting April 9th is going to be able to get the vaccine. So if you get on the list and if it's offered to you, please take it, because it's clearly a life-saving thing that we're doing, getting people vaccinated.
Thank you, guys. And Hawkeye, final thoughts today?
Yeah, I mean, we want to get back to normal. We want to get outside. It's nice out. Get to be with friends. We will be there. Hopefully, more vaccinations will continue to hit the general population, and more people can get it. And we are one step closer. We're one step closer to, singing in congregations. Right now, we're just not there, but we'll continue to evaluate that.
I want to say a special shout out to each of these chief medical officers and all whom are on our program from time to time and are the CMOs here in our hospitals in the Kansas City metropolitan area. We are blessed by a great group of folks. Mark Steele, Larry Botts, and Raghu Adiga are just great folks who do a great job and help keep all of us safe. So thank you guys for the work you do, and thanks for being on our program today. We hear it on the questions, right? We see it in the pictures. We see it everywhere. We are in a wrestling match, and we're wrestling with our desire, and our desire is to get out there and be normal and get together and be social and those things and help make life a lot of fun. And you know what? There is going to be a time and there is going to be a place. But ask yourself this question. If you knew, and remember that the viral levels in the community are much higher now than they were this time last year. If you knew that the actions are going to cause injury and illness to another person who you care about, would you still make the same choice? And I think that's the wrestle you have to do. The wrestle is inside your head. The desire to get out and be around folks versus having to wait just a few more weeks before we can go out and do that and know that the wrestling match is much more on our side. Time, hope, faith, science, they will make us win that match. But if you go out a little too early, we're going to watch the numbers rise. And the numbers rise, deaths rise, sadness, it rises. So be safe, take care of each other, and remember, there's still no place like home. We'll see you tomorrow.